You are watching the Randy Alvarez Marketing Report. I'm Randy Alvarez. Today's topic, why you may want to consider hiring a virtual office manager. With us, we have an expert on the topic, sought after consultant, Jill Coon. Jill, welcome to the program.
Thank you, Randy. How are you today?
Good, good. And we've wanted you on the show now for quite some time, so thank you for coming on the program. So moving on to collections, another service you provide.
Yeah, a big problem with practices that I've noticed is that they have a hard time collecting, especially after insurance pays. They really don't understand that they don't understand insurance and how to collect or what to collect because they don't know how to predict what the insurance is going to pay.
Okay.
So basically, to have to balance bill a patient afterwards, I try to eliminate that process by figuring out the copays for them in advance. Once I know what plans that they're on or what fee schedules they're using, and then what treatment plans that they have, and I go and I outline it, and I say, okay, well, this out-of-pocket's going to be here, this out-of-pocket's going to be here, and then I come up with the total out-of-pocket and give them a total case presentation so that they can present to the patient.
Okay.
And then they're collecting it right then and there. But in the past, let's backtrack it a little bit, because if we're talking about stuff in the past that I'm coming in to clean up, what I would do with them is I would make a phone call and say, hey, listen.
So you call the patient?
Oh, I actually get on the phone and call the patient for the doctors.
Do they hate this, by the way? Is this the part of the job that every office in America hates, the collection part? They have to call and get answering machines and ask for money.
Yeah, they do. A lot of people do not like to do it, and they don't have the time to do it. It's a lot easier to just print a statement and send it out the door and say, okay, that's it. And then you just keep sending monthly statements, and you watch the statement go.
Or an email or whatever.
Right. And I get on the phone and personally call and say, okay, listen, you've had this balance for a little while. What is it that I can do to help you? How can we come to agreement? Would it be easier if I finance this for you over a period of months? How can I make it so that you can pay this bill? Without having to, I would never tell them without having to send you to collections, but I like to be really nice with the patients and interact, because every person wants to be treated.
Do they feel like you're from their office? You're calling from the office?
Yes, and I do it with a voice over IP, so they know I'm calling from their office. I'm using their phone.
Oh, really?
Yeah, so I have their phone number on the caller ID when I'm calling.
Is that right?
It's like as if I'm sitting in their office with them.
And how successful? Give me a success story.
I've had practices, actually, the one practice that I was talking to you about that I took from $500,000 to $1.2 million, that practice I got on the phone with different patients individually. I was able to work out financial arrangements with them to get them to pay, and that's how I was able to double the collection.
So did you recoup $20,000, $40,000?
I would say I recouped about $300,000.
About $300,000?
About $300,000.
And is this money that maybe the doctor just looked at it as this is part of doing business?
They usually do. Yeah,
and
they usually do. And they say,
off.
well, let's just go ahead and write that off. And I'm one of these people that won't write off anything.
Okay.
I feel that you've worked for it, you're entitled to it. It's like, are we going to go to a grocery store and go buy groceries and say, okay, I'm going to pay you later? Or ask them for a discount because I'm entitled to it.
So you have a knack for this?
Yeah.
Okay. So it's
really
different than
enjoy
just hiring a collection agency to do this that could offend your patients. So you're obviously handling it in a delicate way.
Yeah, and you have to. People are people. People need to be spoken to like people. They don't need to be spoken to like they're criminals.
And who in the practice normally handles this?
Usually it's a front office person or an office manager that would do it, or a financial coordinator.
A lot of answering machines you get?
Depending on the time of day that you call, yeah.
Okay.
Yes, and it also depends on how friendly you are. I mean, you don't want to constantly bother a person while they're at work, but you do want to try to call them at certain times of day.
So this part of what you do, I mean, this pays for itself.
Oh, it absolutely
Obviously.
does.
I mean, right away. They can see results on this.
Right away. Yeah.
Right away.
Now, I do have, for those that cannot afford to pay, or those that will not pay you for some reason, I do have a collection software company that I work with, and it's a collection agency, but you in the practice have control over what's going on, and you can see if the patient's being contacted, when they're being contacted. You can send the letters when you want to. You can follow up, and you keep track of it all. And basically, you just give the collection agency a little bit of money because you're utilizing their software.
Do you get a percentage on what you collect, or are you working on an hourly fee?
I'm working on an hourly fee.
That's good.
Yeah.
That's good.
I'm working on an hourly fee. And that's the same way that I do it with the insurance and everything else that I'm doing.
So the office manager, the front desk, they must love this part of it.
Oh, they do.
Because nobody wants to deal with collection.
No, because they don't want to be like, I don't have the money. And they feel bad because they like the patients. You know, it's better for someone that doesn't know the patient to get on the phone and can be really nice and sweet and say, listen, I know this is going on. How can I help you? How can I help you so that we can get this paid?
Good.
What is it that we can do collectively as a team to get this done?
One of the things I should mention, because this is a business report, part of my show. And doctors are hiring consultants oftentimes. And this is my frustration, by the way, that they'll hire consultants and they never check and find out what their experience is.
There's many consultants out there that don't have experience.
Exactly.
They're not in the trenches every day.
So you have actually built 2 practices on your own, proved it in the numbers, and you've been in the business over 27 years.
Yeah.
And so what should you look for in somebody that's going to be your virtual office manager or your virtual assistant?
You want somebody that has dental background experience, somebody that understands insurance experience, understands insurance, how to bill insurance negotiations, insurance fees, how to figure out the co-pays. You want someone that is actually customer service oriented, that can actually turn around and explain things to the patient in layman's terms, not in dental terms. You want somebody that can talk eye to eye or knee to knee, but really nice and like a normal person, not above the patient. And you want somebody that, as a virtual office manager, you want somebody that is going to be looking out for your best interest, that understands the ins and outs of dentistry. Somebody that actually goes to continuing education credit courses every single year.
You do?
Yeah. Oh, yeah. I myself have over 100 hours at CEUs every day.
You were at a MISH. We talked. You were at a
Yeah.
MISH
Convention.
meeting.
Yeah. I just came
So
from
you
this
sit through
weekend.
those.
Yeah, I love to sit through them. And the more knowledge I have, the better it is for me. So I'll sit through anything. And it really helped me grow, and that's what actually helped me be able to develop the systems that I have to get where I am today, and to get the practices where they are today as well.
What about your retention? That means doctors that have been using you. Do you keep numbers on that? That means how many people that have hired you that keep you?
Oh yeah, and everybody that I've
80% keep you?
Good 95%. And then what ends up happening is that they'll get comfortable with me, and then they'll feel like they can do it on their own. And then they'll leave me for a few months, and things start to slide. They'll call me back.
Well, if I were the office manager, I would beg the doctor not to let you go.
Yeah, some
obviously.
do. Some do, but for some reason, some people feel that they can handle it after a little while because they feel it's easy.
What excites you most about what you do?
I love making a difference in the practices. I love when I can see the huge difference and when I see the profits that they're making. And I love bringing joy to people's lives by doing that.
What are compliments? Give me a compliment that you hear from a doctor that makes you feel good.
Wow, I've never been able to do this before. I've never seen results like this.
Is that right? Mm-hmm. Good for you. Okay, let's move on to recall, another part of your business.
Okay.
Getting patients back in, I guess past patients. What are the categories of recall we're talking? And patient retention.
Patient retention, there's different forms of patient retention and patient recalls. You've got the regular patient that's due in for their 6-month or their 3-month cleaning that doesn't have an appointment. We need to get them on the phone and schedule them. Okay. We've got the patients that haven't been in the practice that are overdue for their cleanings. Let's say it's beyond 6 months.
Like a year, 2 years, whatever.
Right. And, then we've got that. And then we also have patients that are due for regular treatment that have not been in or haven't scheduled for some reason. So I get on the phone and I call these patients and get them in.
But isn't this something maybe they don't need, that because there are computer programs, there are companies?
There's always that. But you know what? These computer programs, they're great. I love them. They're an adjunct. You need to use them. But you also need that personal touch. You need somebody, a personal touch and a voice on the phone. Yeah, it makes a big difference. I mean, do you like getting automated calls all the time?
No.
But isn't it nice when you get a live
I do get them
person?
from my dentist.
Okay.
On my phone. And a call, but you're right. It would be nice to get a live person to call me. But there's no time for this, obviously.
No,
doctor, if you've touched 2,000 patients, there's no way.
No, the staff doesn't have time. They're busy pulling charts, filing charts, checking in patients, checking out patients. They're busy answering phones. They don't have the time. They need a virtual office person to be able to help them with that.
Okay. Now, have you? And when doctors, what are they more interested in? Is the recall of the people in 6 months, or the people that haven't been there in 2 years?
Honestly, I think that they're interested in both. They're interested in both. I mean, the longer period of time that the patient's out of the office, the less likely they're going to come back in. So you want to focus within a year or two.
You say this is an adjunct to the software that notifies these people.
Yeah.
Are you saying you do both? So you call and you send the computer?
Absolutely. I do both. I do both because it's nice to send the notification, But then it's also nice to pick up the phone and say, "Hi, Mrs. Jones, you haven't been in here in a while. Dr. Smith has been reviewing your chart and he noticed that you haven't been here. He's very concerned about your dental health. How are you doing? Can we schedule you an appointment? Let's get you in for a checkup and a cleaning. I'm offering you this 10% offer to bring you in."
Nice. On the machine.
Yeah.
Okay. And do you show this in results as well? I mean, do you
yes, I
track
do.
all of this? Do you
Yes,
give them a report and say, hey, we got 25 people in,
Yes, as
we
long as
recouped X amount of money for insurance?
Yeah, and it's really neat because I can show you in a list form in Excel spreadsheet on how many patients I've called, how long it's been since they've been in, and when they've actually scheduled and when they've actually come in. Meaning, because you can schedule, but they don't show up. But I want to make sure that when they come in.
With all the money that you increase to their bottom line, so you save them time, you increase profits. Does the doctor ever, when they look at the chart, say, Jill, we're not paying you enough?
No.
I'm joking, by the way. They don't say
I
that.
can't imagine them saying that, but I wish they would.
But they look at these charts and they're probably thinking, oh boy, I hope she doesn't raise my fees.
Yeah. Well, yeah, of course they think that. I mean, that's a natural ability. That's what they want. They want increased collection. But of course, what I do notice is that when I have done nice results like the ones that I'm sharing with you, doctors really give me nice bonuses for that. But they don't want to keep it at that every month.
Now, you say in certain cases, you even develop relationships with the patients.
Oh,
on the
absolutely.
phone.
Oh, yeah. Patients are emailing me and asking me co-pays and, hey, listen, this insurance paid me this and I was supposed to pay this amount. Can you refund me the money? Absolutely. I deal with patients all the time.
Interesting. And do they ever, didn't you tell me that sometimes they've brought in gifts for you at the practice?
Yeah, they have.
Cookies or something?
Yeah, they have. And then the staff has to mail me the package, which is really nice. It's really funny. I had one office actually send me roses. And,
Very nice.
But they, not the office, but the patient sent roses to the office. And then the office had to overnight the flowers to me. And they were beautiful when I got them. Really pretty. Multicolors. And it's really nice and rewarding for me because I've developed a nice relationship with the patient. And it's nice for the doctor because here it is, somebody off-site that actually boosted the practice and boosted the confidence, the patient confidence in them.
So when you talk to a doctor, and they're skeptical, right? Number one, they probably don't even see a need for you at all. They're saying, I already have an office manager. This is why I pay them. I have a front desk. This is why I pay them. So what do you say to them watching this?
They don't realize that they have money on the table. They don't realize what's out there and what I could do for them. They don't understand how I can change their practice and increase their bottom line and increase their income.
Because there's a side effect to all of this, by the way. And I help market practices as well. But if you free up their employees and you say you show it in the numbers, that means 4 weeks later, oftentimes you can more than pay for yourself.
Oh, absolutely.
Is that right?
Yeah, that's correct.
Like they could double their money, more than double their money by using you. Okay, but the side effect here is that when your staff is freed up to give more attention to the patients, right, they're probably now going to make more money with the patients they have.
Oh, absolutely.
Or spend more time on those incoming phone calls.
Absolutely, because patients want one-on-one personal touch. They don't want, when you go into a doctor's office, do you want the patient, do you want the personal relationship, don't you?
Yes.
Or do you want to be just a number? Do you want to be just a number where you have to sign in and then you don't really know them? This actually builds the rapport, it builds relationships. That's what we need to be doing to increase the production of the collections in any business. And having somebody like me increases the number behind the scenes even more because it allows your regular staff people to be focusing on who's there right there. And
Have they told you that, by the way? That they've increased patient case presentation, or they can spend more time on the telephone?
Oh, absolutely. Absolutely, they have. And the reason being is because they see it themselves. Their patients are scheduling more. They're doing more treatment. They're feeling more comfortable in the office. They're feeling that they're not a number anymore. And they really, really, the staff themselves really notice the flow is much smoother. Okay. It's much more comfortable for them because they're much more relaxed because they can be themselves and be, instead of, oh, I got to answer the phone. I got to do this. Oh, I'm sorry, Mr. Jones. Hold on 1 second, you know. It's much more personal touch.
So when they hear the term virtual office manager or virtual assistant, this is not to replace the office manager. And, you know, initially when I first met you, because I know there's companies that sound like yours, I always, when I first met you on the telephone, I thought you were only taking care of business when they were closed.
No, I want to do the day-to-day stuff while they're open.
The day-to-day stuff.
Right. I mean, we can't answer the phone, but I'm not an answering
You're not in
service.
that business
No.
as the answering the phone business.
No, I don't want to do that. That's not something that I'd like to do.
That's
I
not
like
your
to,
expertise.
Right. That's
or
not
your
my
specialty.
expertise. No, definitely not my specialty.
So we are out of time. Final message to an office manager, dentist, and they want more information.
Just have the dentist call me. Pick up the phone and call me. There's no charge for a consultation with me. I'd like to see what's going on and help you and make a difference in your practice and in your life.
What's the nicest thing an office manager has ever said to you that sticks out?
Thank you very much for helping me and taking the weight off of me. It's made my life much easier.
Good, good. I want to thank you for coming on the show.
Thank you.
Very nice, very nice. You've been watching the Randy Alvarez Marketing Report. We'll be right back.